This video is a straight-to-the-point, no frills, and no buzzwords 6-step guide to lower creatinine levels naturally and to improve kidney function. I've been receiving a lot of requests of this kind lately on the channel, like this one: I need help. Hello, I need help to improve my kidney function. I am only 19 years old and have CKD. My function is at 39%. I need help to control my blood pressure. And another one: what's good for supplements or natural items to lower creatinine levels? Or this one: I have just been diagnosed with CKD. My GFR is 45, my creatinine is 3.5. What do I do? Please, I'm scared. I'm here to help. Today, I'm making a video for all those people who may have been diagnosed recently or who have just entered a new stage and are overwhelmed with symptoms, complications, or dietary restrictions. So, this guide is going to be as easy as possible, especially to help all those people watching me who really don't know where to start from to improve their kidney function. There will be just 6 very easy steps that anyone with kidney disease can start to follow. So let's start immediately with the guide. Our very first step is: Step 1, don't panic. The very first thing I want you to do is take a deep breath. Please, don't panic. I know how frightening it is to be told you have kidney disease. It feels like your whole life just shifted in a single moment. And it doesn't help that, so often, the first thing many doctors say is, kidney disease only goes in one direction worse. I can't tell you how many people I've met who walked out of the doctor's office with nothing but fear. No guidance, no diet plan, no treatment options, just a sense of hopelessness. But here's the truth I want you to hold on to: there are ways to fight back. I've seen people do it. I've seen people improve their kidney function, lower their creatinine, and take back control of their lives. Let me share a message from one friend that touched my heart. Like so many of you, when I was first diagnosed with CKD, I was terrified. I asked my doctor how much it would shorten my life. He smiled and said, "Put it this way, I have patients in their 80s who still have useful kidney function." That answer gave me something I didn't expect: hope. From that day, I changed. I started researching. I worked with my doctor and dietitian. I improved my renal diet. And slowly, I began to see changes: small improvements in my blood tests, and a huge change in how I felt inside. Yes, I have CKD, but I'm still me. And I choose to be the best version of me. Isn't that beautiful? That's the kind of seed I want to plant in you today, hope. Because yes, it takes work, but it's worth every step when you start seeing even small improvements. So if you know someone else who's feeling hopeless, please share this video with them. Sometimes all it takes is one spark of encouragement to change someone's entire path. And remember, you are not alone. You have me, you have this community, and you have more strength than you realize. So never, ever lose hope. Step 2 of 6, lower your protein intake. Now, let's talk about protein. I promised you this guide would be simple, and this step really is, but it can make a huge difference. Protein is a tricky one. Most of us enjoy it. Who doesn't like a good steak once in a while? But here's the problem: animal protein, especially red meat, is very hard on the kidneys. Why? Because red meat naturally contains creatine, and when it's cooked, that creatine breaks down into creatinine. So when you eat it, your creatinine levels can go up, and your kidneys suddenly have to work much harder. This is why people who eat a lot of meat or dairy often see higher creatinine levels. But here's the good news: you don't have to cut out protein completely, you just need to be smarter with your choices. Start leaning more toward plant-based proteins like beans, lentils, nuts, seeds, and whole grains. They're gentler on your body, easier to digest, and most importantly, they don't overload your kidneys. And there's another bonus tip here: fiber. Adding more fiber-rich foods, fruits, vegetables, whole grains can actually help reduce creatinine levels, too. Think of it as giving your kidneys a helping hand, so they don't have to clean up as much waste in your blood. Now, don't worry, I'm not telling you to go vegan overnight. That's not the goal here. What matters is finding balance, cutting back on red meat and dairy, and making room for more plant-based meals. Even small swaps, like choosing beans instead of steak once or twice a week, can take a huge load off your kidneys. Ideally, every kidney patient should have a personalized renal diet plan, something tailored just for them. Sadly, not every doctor gives their patients enough information to get started. If that's you, please don't feel discouraged. You're already taking the right steps by learning, and you can absolutely work with your doctor or dietitian to build a plan that's right for you. For now, just remember this: less protein stress means more healing time for your kidneys. And that's exactly what we want. Step 3. The 4 life-saving tests. I know those blood test reports can look like a foreign language, sometimes full of numbers and strange terms like hemoglobin, hematocrit, blood urea nitrogen. It can feel overwhelming. But here's the good news: you don't need to master all of it. You really only need to focus on 4 simple, life-saving tests. These are the ones that matter most for your kidney health. Let's go through them together. Test number 1, blood pressure. This one is huge. High blood pressure is the second leading cause of kidney failure after diabetes. And here's the tricky part: high blood pressure damages the kidneys, and kidney damage raises blood pressure. It's a vicious cycle, but one you can break. So, what's a healthy score? Below 140 to 90 is good for most people. Below 130 over 80 is better if you already have kidney disease. And the gold standard below 120 to 80 is best of all. The best part? You can check this yourself at home with a simple device. Test number 2, protein in the urine. This is often the very first sign of kidney trouble. Protein isn't supposed to leak into your urine, but when it does, it's a red flag that your kidneys are under stress. If you're at risk, maybe because of diabetes, high blood pressure, or a family history of CKD, please make sure this is checked regularly. The number to remember: less than 30 milligrams of albumin per gram of urinary creatinine is normal. Anything higher means your kidneys may already be damaged. Test number 3, serum creatinine, creatinine in the blood. This one you've probably heard of. Creatinine is a waste product from your muscles, and healthy kidneys filter it out. When kidney function declines, creatinine builds up in your blood. Normal levels are 0.6 to 1.2 mg/dl for adult men, 0.5 to 1.1 mg/dl for adult women. When the numbers rise, it's a sign your kidneys are struggling. This test gives you a direct window into how well your kidneys are working. Test number 4, glomerular filtration rate, GFR. This is the most important one. GFR tells you how much kidney function you have left. It's calculated using your creatinine level, along with your age, gender, and sometimes race. A GFR below 60 for more than 3 months means chronic kidney disease. Knowing your GFR helps you and your doctor understand exactly where you stand and what steps to take next. So remember, you don't have to get lost in the dozens of numbers on a lab report. Just keep your eyes on these 4: blood pressure, protein in the urine, creatinine, and GFR. They'll give you the clearest picture of your kidney health, and most importantly, they can save your life. Step 4 of 6, don't take NSAIDs. This next step is really important, my friend. Please be careful with over-the-counter painkillers. Medications like ibuprofen, naproxen, and yes, even aspirin belong to a group called NSAIDs. And while they may seem harmless, taking them regularly can quietly damage your kidneys. In fact, they're responsible for up to 5% of new chronic kidney disease cases every year. I know what you might be thinking, but I take those for my migraines, or for cramps, or just when I get a headache. Believe me, I understand. I used to reach for them without a second thought, too. It felt like such a normal habit. But here's the truth, NSAIDs are nephrotoxic, that means toxic to the kidneys. And if your kidneys are already struggling, these drugs can make the damage worse. That's why, if you're living with CKD, avoiding them is one of the smartest, most protective steps you can take. Now, don't panic if you've used them in the past. What matters is what you do moving forward. If you need pain relief, always talk with your doctor first. And remember, only take painkillers at the lowest dose possible, use them for the shortest amount of time, never use them daily or long-term to manage chronic pain without medical guidance. Your kidneys work so hard for you every single day. Protecting them means being mindful of even the small choices like which pill you take for a headache. Step 5 of 6, find a good kidney specialist. Let me ask you something, do you truly trust your doctor? Not just with prescriptions or test results, but with your life? This isn't just a rhetorical question. When it comes to your kidneys, the relationship you have with your doctor can change everything. I've spoken to so many people who feel let down by their doctors, so many that I've lost count. And it breaks my heart, because you deserve a doctor who listens, who explains, and who walks beside you on this journey. So here's the first step, do everything you can to build that relationship. Good communication is the foundation. It starts the very moment your doctor walks into the room. The more open you are about your symptoms, your fears, and even your doubts, the better they can help you. And research actually proves this: patients who ask questions, speak up, and stay engaged usually get better results. At your next visit, don't be afraid to say, "I don't understand why I need this medication, can you explain? I'm worried about this symptom, what does it mean?" You'll often find that having your doctor's full attention and feeling truly heard matters even more than how long the appointment lasts. Now, I also need to be honest with you, not every doctor is the right fit. Some people are too afraid to talk to their doctor because of past bad experiences or even medical mistakes. And I can only imagine the pain of losing trust in someone who's supposed to protect your health. That kind of fear runs deep. If that's your situation, please know you are not trapped. Sometimes the bravest and healthiest thing you can do is find a new doctor, one who makes you feel safe and respected. I know it sounds like a big step, but your kidneys, your health, and your peace of mind are worth it. Remember, this is your life we're talking about. You can't afford to settle when it comes to your care. Take your time, ask for help, and never be afraid to look for the right specialist who will stand by you. Step 6. Keep getting informed. Yes, information is power, especially regarding your health. I've tried to be as concise as possible with today's guide, and I really hope that I was able to give you enough information to know where to start. But this is only the beginning, so keep getting informed and keep following me. This is all for today. Thank you for watching.